Hi, I'm Vivian and we're here at Port Jefferson Pilates, and today we're going to do a collaborative video showing you how physical therapy, Alexander's technique, and Pilates work go hand in hand. We're hoping that it will sort of help you and give you an idea of oh wow, look at the possibilities out there.
You've had back pain for quite a long time.
Definitely by the end of the day, my lower back, I'm just done.
It's right along the back, right through there.
Yeah,
kind of just
from here to
midline. All right. So when she was pregnant, she leaned back quite a bit. And when she was doing that, she caused one of her vertebrae to continue to bend. And now everything else in her back has locked up above and below. They don't move anymore, and only the one joint moves. So what we're going to do right now, actually what you're doing, is you're trying to get each segment to move individually so that you can start getting movement from other spots in your back. Trying to just control that descent is really difficult, but what we're really working on here is just being mindful about your movement, learning how to move each segment individually. We're going to try and get you to move from anywhere other than there, okay? So what I'm going to have you do is you're just going to reach forward and then reach back as far as you can back. That feels really good, right?
Yeah.
All right. We'll do 5 of those on each side. Normally I give 20, but I would say you still probably have about 1.5 inches of a diastasis recti. I had it on for about maybe 8 weeks of it before I took it off and I didn't have my problem anymore. What I'm going to have you do is you're going to try and lift your hip to match this side.
And leave my knee where it is.
Yep. No, you're going to lift, you can lift this knee too, don't worry. Take your knee with you. Just a little less. Right there. Hold for a count of 5. And then lower. It's working all of the little guys up and down your spine. And it's about little movements for this. It's more of a stability issue. As soon as she used all of her muscles, the pain went away, which is wonderful. It's very good news. It means that by doing some work to stabilize that part of her back and getting her to be able to move from above and below that spot, she could be doing quite well.
If there's compression down into this area where she's already having pain, it just keeps kind of pushing on the vertebrae, as well as she's losing strength in all the muscles that she could be working. So what I see is a little bit of a compression with the hips kind of pushing forward a little bit here, and a little bit of the neck kind of pulling down a bit. So those are completely related. If the hips are pressing forward, the upper spine is going to be compressing and pushing forward as well. But this is where we want to go, with a little bit more space in there, which naturally creates more space up through the rest of the spine, up through the ribs, and a little more space through that lower back. So what we're doing here is we're getting all this space up through her spine, and now she has access to muscles here that she didn't have access to before, and that's a big part of this. When this is all compressed and she lifts her arms up to do anything, it's going to come from her shoulder. It's going to come from up here, like up through her neck. This is what's going to do the work, because this part of her back is being compromised. She's kind of lost the integrity here. But when we lengthen up, now lift your arm up, it comes more from underneath here. Yeah, can you feel how that's coming from a different place than if you were to kind of slouch down with it? Take your hands and kind of put them behind your head like this. And put your thumb kind of in front on your skull. Now give yourself a little lift there. Yes, now bring your arms down and try to maintain that lift. So not only is there maybe work that could be done here specifically in that area to help with the pain, but we have to get off of it. We have to stop having the muscles just sitting on that part, because it just makes it worse for this as well as the rest of the spine. She really needs to strengthen all the muscles up her spine, work on her posture, strengthen her whole body. So Becca, imagine that the 2 sides of your pelvis here are like curtains, and you're going to close the curtains across to the middle. So bring the curtains together in the middle. Beautiful. Already her core is engaged. Now use that energy to straighten your legs and pull the carriage out. Great. And stretch and come back in.
and pull out.
Do it again.
Yep.
Try not to look up a little. Yeah, you want
And
that nice
come in.
long neck that you were doing with the Alexander
Great.
technique.
Now I'm going to put her arches on the bar. Relax your hips, connect those two curtains together, and stretch out. So right now Becca is very symmetrical, and come in. And now Becca, feel your heels drawing down to the floor. Relax your chest and move from your lower core just like you were doing. Engage and stretch. Okay, now we're going to put your heels up on the bar. Good. Beautiful. And I'm going to really look at her foot placement now because the feet relate with everything that's happening in your hips and with your whole body. So stretch out again. Imagine you're standing on the floor with your feet and you want your feet to be even on the floor. Good. And come in and keep your soles lifting up as you come in. Good. Like you're really squatting down on the floor. Engage your curtains and pull the carriage out. Keep your feet straight. Good. And come back in, keeping your feet as if you're standing on the floor.
Nice.
And rest. Okay, so Becca, how did you feel after the 3 modalities?
I feel like I really learned a lot today.
Great.
I learned that I'm only using one small part of my back, how to lengthen from my neck, and then how to effectively use my core.
I hope that it gave you a little sense of what you could do with 3 different ways of healing yourself.